Have you ever had pinkish red or brownish discharge? Want to know if it's always normal? Watch this entire video and find out if your reddish brown or pinkish red discharge is normal. Hello everyone, welcome back to my channel, Womb to Super Womb. I am Dr. Samata with you on this journey towards a healthier you. In my last video, I spoke about different colored vaginal discharges, various infections that could cause them, discharge in pregnancy, and how such infections are to be treated. Well, we all know that red discharge every month for 2 to 7 days in a woman between the age of 13 and 50 years is quite normal. Such a bright red fresh monthly bleeding from the uterus that happens naturally under the influence of hormones is what we call chumps, periods, menses, and medically we call it menstruation. Now, besides and barring menses, there are times when one could experience slight variations in the color of blood. It could either appear pinkish or brownish. So today, let's know when pinkish or brownish discharges occur, the reasons for such colors, and if it is okay to have such discharges or not. First, slightly pinkish red discharge around the time, that is a day or two that you are expecting periods, is absolutely normal. Then towards the end of periods, say 5th or 6th day of periods, when the bleeding has nearly stopped and you just have something called spotting, you observe darker color or brownish red color discharge. This is also normal. But why does this happen? So, when the quantity of bleeding or the force required for the flow of blood caused by the uterine contractions is not enough, the blood remains somewhere along the outflow tract, mostly in the vagina. This blood, which stays in the vagina for a long time, gets oxidized. I mean, this blood combines with oxygen, because of which it turns brown in color and appears as brownish discharge. On the other hand, if the flow is good enough, then the blood that comes out is fresh and hence looks bright red in color. Second reason, some women get 1 or 2 episodes of brownish discharge on one particular day, especially around the mid-cycle. For instance, if a woman has a cycle of 28 days, she is likely to get a discharge that is just a drop or two brownish in color around the 14th day in the middle of the cycle. This is called ovular bleeding. This shows that the woman has ovulated in the last few hours. But this may not be seen in all women. But women who get pinkish or brownish spotting or mild bleeding, say 7 to 8 days before the commencement of periods, or who have similar discharge continuing even beyond their normal days of periods, is not normal. This could be because of hormonal imbalance. Hormonal imbalance is a major reason for less amount of bleeding, which can invariably cause brown colored discharge. Medically, any condition that causes scanty bleeding during periods or less amount of flow than you normally have is called hypomenorrhea, and there are many reasons for such scanty bleeding. First, physiological reasons for imbalance of hormones. This is seen in pubertal girls. Initial few periods are mostly scanty, irregular, and the girl may have brownish spotting occasionally. And at another extreme of reproductive life, wherein a woman who is likely to attain menopause in the near future may again have irregular bleeding, periods could get scanty, and the discharge could appear brown in color. Next, imbalance in the supporting hormones like thyroid hormones, or in condition like polycystic ovarian syndrome or PCOS, can also cause irregular, scanty bleeding, or sometimes just spotting around the time of expected periods, or the periods may not appear. Also, there could be system related, that is, the whole body system related problems like malnutrition. When I say malnutrition, it could be undernutrition or overnutrition. In overnutrition, being overweight, obese, or morbidly obese, that is the BMI or the body mass index, more than 25 can have a negative impact on the hormonal levels, leading to less bleeding, and the bleeding could appear brown. Next, there could be some lesions in the reproductive organs, could be cervical erosion or small growths such as polyps, or infections, could be pelvic inflammatory disease, or any other sexually transmitted infection, especially in the acute phase, or later stages of genital tuberculosis could also cause scanty but persistent brown discharge every day, or more often between the periods on and off. Even more serious issues like pre-malignant lesions of the cervix, or earlier stages of cervical or uterine cancer, there could be such slight and recurrent episodes of brown discharge. In pre-malignant and malignant conditions of the cervix, there is typically something called postcoital bleeding, that is, bleeding after intercourse. If the bleeding is profuse, it appears immediately as fresh bleeding, and if it's scanty, it could appear at a slightly later time as brownish spotting. But such a discharge in the initial episodes of penetrative sexual activity is normal. This is due to rupture of a membrane called hymen and small capillaries that are filled with blood. When a woman in early pregnancy comes across brownish discharge, it could be because of A. threatened abortion, B. ectopic pregnancy, or implantation bleeding. Hence, it is just not enough to know you're pregnant or not with a pregnancy kit at home, but also to confirm that the implantation has happened inside the uterus and the pregnancy will continue in a healthy manner. Next, you may be curious to know the reason for pink colored discharge. When the blood mixes with fluid or secretions from the cervix and or vagina, it gets diluted and looks pink. Women are also concerned about the color of their discharge after delivery. The blood that is seen after childbirth is called lochia. It is a discharge that looks similar to menstrual blood, has an offensive smell, rather a fishy smell, and lasts for about 6 weeks following delivery. This discharge contains mainly blood, mucus, white blood cells, and decidua. Now, what is decidua? Decidua is the endometrium, or the innermost bedding for the baby inside the uterus. Following delivery, what happens is this inner bedding sheds in the form of lochia, and the color of the discharge varies as days pass by. For the first 4 to 5 days, the discharge looks red in color. Next, from the 5th to the 9th or 10th day, it turns pinkish or pale brownish or yellowish in color. And in the last 5 days, it looks pale white in color, and this is very normal. But if this discharge persists beyond 3 weeks, there could possibly be some local genital lesion. In conditions where the discharge is normal, goes without saying that it requires no medical treatment. Only local hygiene is sufficient. But do remember that intermenstrual bleeding, persistent bleeding, needs medical attention, and to know if your brown, pink, or any kind of discharge is perfectly normal or not, it is ideal and very essential to see a doctor. Get the tests, could be blood work or sonography or anything relevant under the guidance of a qualified medical expert. If your condition turns out abnormal, get treated at the earliest. Hope you found this video informative. In my next video, let's discuss the most common complaint among women or something women are prone to suffer from: urinary tract infection or UTI. Why and how exactly it happens, and the ways or tips of preventing and treating urinary tract infection. Stay healthy and stay tuned for more videos. Thank you.